when you were having your morning session.
Mhm.
So hello everyone, how are you?
We fine, thank you. How are you?
Hello,
I'm
fine,
great.
thank you. Hello.
Ken,
Hello.
okay, thank you very much. Is the class rep here? Any of the class rep, can you just prompt the others to join?
Here.
There's
Yeah,
no
I'll write a
there's no
message on
delay,
WhatsApp.
so we have to start immediately.
Okay, teacher. I
Okay,
call
Just
I'll
prompt
someone.
write
them
on
in the WhatsApp
WhatsApp.
group. Yeah, and
Yeah,
let
thank you
them
very
know
much.
that
Yeah, thank you very much. Good afternoon to all of you, Level 6 Health and Social Care. Thank you, Rumi. Thank you very much for your support to bring all these students actually here. And Mr. Mujib, I will give you a little bit of introduction of your student and then with your introduction.
Thank
Just to
you.
give you an update, I think we were putting an online event, but I think we already had online classes today because of the teachers' strike anyway. So I think mostly students are actually now online. So, guys, we will welcome Mr. Mujib Chaudhary. He will be joining us for this event today. And the idea is he will himself explain you what is his background and what exactly the plan is. But one thing just to let you know before we start that you are at level 6 at this scale. And I think very soon you will be a graduate. So the point which we are putting at Waltham International College is me as a placement manager and looking into employability and obviously with the support of the program leader Rume. We're trying to give you as much many opportunities as we can provide you in terms of the graduate scale, because we are also expecting you to upgrade yourself to go for better jobs and contributing to your career and on contributing to the society and to the sector as well. So over to you, Mr. Mujib. I think it's from my
Okay,
side we're
great.
starting, and I
So,
think you can. Thank you.
right, so hopefully everybody can hear me. Thank you for joining us all today. So what we're going to talk about is basically Calvic Enterprises, which is a care company. We're operating in London as well as Birmingham. And the whole purpose of our sort of interjection today is to identify people who may be interested in becoming a registered care manager. Because you're level 6 qualified, I'm hoping some of you have done your placements and done some practical experiences. We're looking to see how that fit with the organisation. So we deliver domiciliary care provision. We also deliver supported living provision in London. So dom care is primarily going out into the homes and providing care, working with people who need that support, administering medication, maybe bathing them, giving them that support. The supported living provision is more about equipping people to become more independent and how they move forward in their life. This is a very difficult thing when it's online because we don't see the faces and we don't see the expressions, so it's very difficult. So really it's about seeing what opportunities as an employer we can provide you with, whether that be something within the care industry. Now the care industry has various roles that can start from being registered care manager to going into compliance, to going into business development, to going into looking at making sure that you design and develop activity for people who within our care. It's not just about providing the domiciliary care part of the service. It's about looking at how we integrate that and how we support people to become more independent. So it's about equipping them with skills as well. Primarily, a registered care manager's role is to make sure that the service is compliant. I hope some of you know what CQC is. For those of you who don't, it is a Care Quality Commission. So therefore, any care work is regulated activity, which means that it is always under scrutiny by an external body who would always come in and assess whether the care agency is providing the appropriate level of care and ensuring that the individual that we're dealing with is safeguarded. So as a care manager, that would be the responsibility of the care manager to ensure that that happens. CQC governs across the healthcare service, so whether it's a GP practice or whether it's a hospital, it regulates the activity for those organisations that provide healthcare primarily. The key thing about working in the industry is about making sure people have the right qualifications, and that starts with from the basic of having the mandatory care certificate if you're a care worker, from NVQ level 2 to level 6 graduates like yourself who may have more to do because of your qualification that you've got, and looking at the types of roles that you may be suitable for. As I said, those that have got experience within the field, this might be the right opportunity for them. Any questions? I know you're all on mute, but if you've got any questions, please ask them now.
Yeah, hi. So basically in regards to this job, I think at the beginning we will have like a sort of a training, for example, for the care home manager, because even if we have some experience in the field, each care home, as far as I know, is working by their own rules and their own patients and their own colleagues. So I think it will be a sort of a training for a couple of.
Yes, so the business processes are different primarily in different care organisations. You're absolutely right. However, the care aspect of it is regulated, so the policies and procedures, whether it's in a care home, whether it's in a dom care agency, are very much standardised because there are certain rules and regulations that you
I'm
put.
already working with them. I'm working in the PCN, so basically
Okay.
I have to follow the rules of the CQC,
Yeah,
of course.
yeah,
So I
of
know.
course. So are you working with CPNs, did you say?
So I'm working in the Red Bridge
Okay.
for PCN for the GP practices, and as a GP practices, we work with the care homes as well.
Yeah.
So we link all of them together.
Yeah, that's fine. Yes, you're absolutely right. You know, if you're going for a registered care manager position, you would be mentored, you would be supported, and then you obviously have to have your registration with CQC. So there will be a CQC interview, which will then qualify you to become a registered care manager. But that support will be provided by the organisation. The organisation will work with you to ensure that you're prepared, you understand what the process is at and the question. So absolutely correct. So have you worked in care before, other than the PCN setting that you're doing?
I'm going time to time in the care home, so I can't say that I'm working in the care home, but for example, next week I'm going as well. The more that I do, I interact with the patients, but then I put everything in the system. So I make sure that everything is documented. By the doctors. So yeah, it's working hand to hand with the doctors. So basically, yeah.
Great, thank you.
Thank you.
Anyone else? Can't hear you, you're on mute.
Actually, I was working in a senior care assistant in a care home, residential care home. I worked there about 10 years. So
wow, fantastic.
I was running the shift, and then I was like, if manager is off, so I was the one who is responsible for the taking care of all the staff, or like kitchen staff, care staff, and domestic, everybody. And I was also supervising them and apprising them, and attending the meeting with the family and care assessment, doing the care assessment, and then I was also a key worker, so just to give a person-centered care, so just assess them and involve the family members and decide what care plan we can provide to them. And I was also involved in training the care staff where it comes to health and safety, infection control, like that. That was like maybe 10 years ago, but now since 2017, I'm working as a dental nurse. There actually I'm assisting my dentist in preparing the procedure and also communication, effective communication. I need to attend the phone calls and again interacting with the patients and the families, and then sometimes I have to talk to the other when we are sending a referral to the other people like orthodontic or something. I need to initiate with them, then tell about the information about the patient or something. So keep up to date, and then also I'm involving in sending a reference, online reference to the other department like that.
Fantastic. And is your aim to become a dental nurse then?
No, it is not. Now I'm studying as health and social care, so I'm just thinking further, so when it is this opportunities came, and our sir Faisal said that you see something is coming up, it may be useful her. So I was interested, everyone likes, going further and do something nicer. So this is, I think it is a good opportunity for us. Think how we can improve our skills. And as far as it is come to care manager or something, since I was running the home care home, it was 28 residents in the house. So you
Yeah.
have to if something happen, emergency, calling the ambulance, or you need to take a decision then and there only, how to react with the situation. So the whole home is with you. So I think I am quite capable of doing that, because it is not something new I have to go and learn, because I already learned that one already. So I'm confident.
Yeah, absolutely. So you clearly have got the practical experience.
Yeah.
As that'd be great. So if you could get your CV across to Rumi,
Yeah.
and we can perhaps have a chat when we come down next week to London.
Okay. Yeah.
Great, thank you.
Thank you, sir. Thank you.
Hello.
Yeah.
Any other person, please?
Anyone else, please?
Mommy, Alexandra, where are you?
Yeah, I think it's a great opportunity. Please ask any question.
Yeah,
Obviously,
it's a
Mr.
great
Baji will be with us
opportunity.
Thursday, but I think as a curiosity, because Mr. Baji, one thing I just want to, in the meantime, students are coming. There's one common question was coming in the form of feedback, when I was doing it earlier, because they've done the placements at level 4 and they've done the placement at level 5.
Yeah.
And obviously level 4 placement was a bit shorter placement and level 5 is a bit higher number of hours. So one thing I think you can see that Sujata was also saying, we have students who have worked for many years in this health and social care sector, but they're looking for a change of roles as well. So but they have a little bit of hesitation, and they were asking the question, is there any possibilities they can switch the roles as well, somehow within the sectors? It's quite easy, or it's a bit
When you say
challenging?
switch the roles, there are various roles. So if you take the journey from a care worker to go to a senior carer, to go to a registered manager. From a registered manager, they could go into compliance, they can go into business development. There are roles within the care sector, or they could be somebody that looks at researching new ways of working. It depends where that individual wants to go. As you know, people can work and get their diploma in nursing as well. So it just depends what the individual wants. It really does depend.
Hmm.
Or you could become a tutor teaching. It can
Yeah,
vary. Or an assessor assessing health and social care qualifications. It really depends on what the individual wants to do.
perfect. Like for example, we have Hambushi. I think Hambushi, hello, how are you? We have Hambushi here, and I've received several times the request from one of the student. Like Hambushi can also speak, if that would be great. Like for example, some of the students, they are not directly in the health and social care sector, but they really want to enter. So they were also thinking for some very basic initial kind of roles they can apply. So can we also help in that matter, isn't it?
Yeah, of course. So the entry route for caring is becoming a care worker
Yeah.
and then
Ambushi,
working with.
yeah. Okay. So Ambushi, you want to ask any question? We can see you, or anyone else,
Can I
please.
ask? Yeah.
My laptop, it's no voice. I don't know why.
No problem.
You see, you talk about the care, because I was a carer for 2 years, 2009, 2010, long time. But I have experience for care because I work 2 years, and but that time it was give a report. If you go to visit the client, you need to report it. You need to write, but now it's on the computer things. Every time it's change, the new machine come, they change the new system. But me, I work when I was write a report for paper, for book. Book was there. When you come, if you see something wrong, you need to write. When you come, before you go, you write a report, because social worker when you come after you, or another colleague when I come after you, she need to read to know what happened before another people come. But I have experience for care.
Yeah, correct.
I was a worker care home to home.
Mm.
That's why no nursing room. Only work here all day like that.
And did you enjoy it?
So that's more like a domiciliary, I would say, right?
Yeah, so the dom care
Yeah.
side is what we're looking
So
for.
that's the
Yeah.
home care.
Yeah. But I have experience. I have experience for care, because I know I not to use a lot of machine because I work at a clinic now. The clinic have the machine. So, they have every time I try. When I go, I try. My friend said, "How you know?" I said, "I was a care. I know how to do it. I have experience."
Fantastic.
That's good. Glad to hear from you.
Yeah.
So, Mr. Mujib, this technology which Hamboshi has mentioned, obviously, when they're going into employment, I think companies are always considering, isn't it, in terms of the
Yeah,
training of
so I
everyone?
think so. So now, as you can imagine, even way before COVID, the CQC preferred to have electronic system because it's easier to track, it's easier to find out what's going on. Your MAR charts, your medication administration, all of that is in one system. You can update it, the client's families can access it, the client can access it, the service user can access it.
Yeah.
It's very much a 360-degree system, which is really, really good because even for monitoring purposes, from our senior teams, we can look at what's happening in the business across the sites. So you're absolutely right, you would get trained up. But the reality is these sort of systems are now very much user-friendly. So it's all, very easy to use. And even a 12-year-old could use it because it's very basic. They've made it very basic. So it's a lot of tick boxes, free sides for notes. When you're administering medication, the medication will be on there and you tick the boxes. So it's a much better way of working. Now, some of the sites still do have paper-based. We do still have paper-based documents as well. There's a communication log, there's a care plan. Some of the sites do still have that, but the whole idea is everything is going to be electronic.
Yeah. Because that time, for medication, no problem.
good.
Because when you go, you see the medication in the box, and they say Monday, Tuesday, Wednesday. They say when you come, you go, you go for Monday. If morning, they write there. This is the Monday morning, Monday afternoon. It's no problem for medication.
That's fine.
I don't know now if it change. I don't know. But before we work like that.
It's all very much electronic. Regulations are more stricter because what you have to understand is when you're administering care, if somebody dies in your service, then you are liable if you haven't followed the processes. So it's very much a regulated activity. It's governed very tightly, and it's important to make sure that all the processes are in place.
Yeah.
Okay, thank you.
That's good. That's good.
Any other questions?
I like my job. I like my job. When I finish, I work at that job. I like it so much. I like work care because I like work with you. Not for baby, for adult people.
Yeah.
I like my job.
That's good to hear.
Yeah.
Well, we'll get your CV off the chats,
Yeah.
and then we'll see how we move forward. Okay, thank you.
Okay.
Perfect.
Yeah, as Ambosha say, that's true. My name is Buki. I'm working in daycare nursery, so everything is now like online. So from the place I work, if we do activity with children, we change the nappies, we do the meal time, everything we need to record it. We have every room have the laptop, iPad. So we need to update in everything online, and the parent, they can see what was the day, the routine of the children, what was the meal for the day, and what the child was doing in the nursery, and if the child was not well, or everything is just like online now, the system. Yeah, so I've been working in ethnic social care as well, but I was with the agency, and the agency used to send us in different places. So I was going to nursing home, and I was supporting people from like in the young people in the house, like they have a 5 accommodation, and supporting them, bringing them to hospital, and attending their appointment. And after, we need to record everything, put it online as well, and on the system. So yeah, I've been working 10 years with children and family, and for ethnic social care, like I think more like 2 years. But since COVID, I didn't work with health and social care. So I'm working at the moment with children and family. So I'm looking forward to change. So I don't know when I finish, maybe if it's a good opportunity, I may go forward.
Yeah, so I mean, our plan is to come in next Thursday, and we'd like to do some face-to-face sessions, and sort of take it from there, really, and see how we move forward. So this was just an initial sort of conversation, an opportunity for me to obviously give you an overview of where we're at, what we want to do. We do work with children's as well, so we have children and adult workforce, and we're keen to sort of look at how we sort of launch the children's homes in London as well. So there's a lot going on, a lot of development, a lot of opportunity. It's about just getting piecing that all together and finding the right staff.
Yeah.
So I am going to have to go because I have another meeting at 3 o'clock. If there are any questions, if you want to direct them towards Rumi and Faisal, we can then pick them up at a later stage. But if any of you have got your CVs to hand, and if you want to email them across, we'd be grateful of those. We will send your program leader a copy of the electronic application form, so that, you know, if you are interested, start completing the application form, because as you know, the regulations around recruitment are very tight in the care industry. I'm sure you're all aware of that. So it's best for us to get some of that stuff out the way first. Okay.
Thank you.
Thank you very much.
Thank
Thank
you.
you. Thank you so much for your time.
Thank you.
Thank
Take care.
you.
Bye-bye.
Thank you.
Bye. Bye.
Thank you, sir. Thank you. I'll see you next
Thank
Thursday
you.
then. Thank you, guys. Thank you, everyone. Thank you, Rumi.
So thank you, everyone.
Thank
I
you.
also, during the session, I saw Tasif. Has he left?
No, he's there. I just
No, I'm
invited
still
him.
here.
Uh,
But it's a
can
good
we
idea.
introduce him to the student here?
Yes,
So,
we will.
hello, Tasif. How are you?
I'm fine.
Thank you
Thank
for
you so much.
joining
You know,
us.
Thank you
Yeah,
very much, sir,
please.
for joining. I thought I'd just send you an invite maybe later on, not now in Health and Social in Birmingham, maybe in future. So,
why
So
not?
here's
Please.
one of our head at Birmingham campus students. Okay. I don't know if you've got opportunity to meet him, but I think this is a one of opportunities. So be glad that he's here with you.
No
Hello,
problem.
Hall.
Sir, my
And
question is,
hello, yeah.
no, sir, my question is only this placement is only the health industries or any other opportunities and can switch over.
yeah, they will be here next Thursday, and there is a session between 11:30 onwards. So I think there are more opportunity for you. We can
Hey,
discuss.
girls, are you looking at working elsewhere outside the health and social care environment?
Yeah.
So what sector are you looking at?
No, I'm at the moment I am because earlier I worked for health industry for 10 years and then I switch over to my catering as a basically I have studied in hotel management after I come back to my hotel management studies as a chef, now as a site manager. So maybe I am thinking to move from the hotel industry to some other sector maybe.
So you want to look into safety?
Yeah.
I mean, that's still within the health and social care environment. I mean, you could also work with NHS to probably be their health and safety manager, or depending on your qualification and skills in that area, where you can supervise the safety of their food, the safety of the environment, and all of that. So it's also within the health and social care sector.
Yeah.
And I think next Thursday, Rumi, maybe there he can little bit more discussion, and will be.
Yeah. So nice talk. Yeah.
Will be.
Sorry.
Yeah, so that's perfect.
Okay.
Okay. So next Thursday we'll have more chat. Okay. We'll get
Thank
to have more interaction with the team. So come along with your CV, your updated CV.
Yes.
Everyone, yeah.
It's
Yeah,
a good
guys, thank
touching
you.
effect to it.
Okay.
Add some of the skills you've learned recently into it, and just make sure it's up to date.
Yeah, and one thing just to add, Rumi, before the leave, make sure the placements you do add into your CV as well. So that would also give a little bit of experience and idea to this company that you have some experience into that. So that would be really helpful. Yeah. Okay, guys, thank you very much to all of you, and I think we'll see you very soon then.
Take care and thanks for joining.
Yeah, take care.
Okay.
Thank you, sir. Bye-bye. Thank you.
Thank
Bye.
you.
Don't worry, attendance have been taken
Rumi.
already. Okay.
Yes.
Yeah.
Rumi.
Thank you.
Yeah.
So we
Thank you.
Papa.
And how many of you have submitted your